So today we are in another video of art of ruling out options and how toppers rule out options to get to the correct answer. And today I am going to take shift 1 of NEET PG 2024 questions because as I said that NEET PG 2024 was a bouncer, so let's deal with the bouncer because like that kind of questions can be asked in NEET PG 2025. Before starting, let's see how was the INICET today. A short analysis. So it was PYT based, but less number of same PYQs repeat. Multiple option corrects were there, and my PYT list strike rate was moderately good. And the most important thing that you understood by this exam is that you need to rule out options. Most of the answers you didn't know the correct answer, so you needed to rule out options. एंड मेरा एक गो इंस्टाग्राम का पोस्ट तो एकदम क्वेश्चन में आ गया. दिस वाज द सेकेंडरी सिपिलिस एंड लाइक दिस काइंड ऑफ इमेज वाज ओनली गिवन इन द क्वेश्चन. So let's move on. How was the INICET? You will get n number of recall videos. Now let's just move on because in 1 week only you will get the results. But NEET PG is our staple diet. So let's start with solving MCQs. Now identify the drain. Think you don't know anything. Okay, what is this drain? You don't know. I also don't know. So अगर यहाँ पे जो drain है यहाँ पे collection होगा. If I insert this into the body cavity, it will become closed. See, there is no opening. Okay, no opening. So if I insert the tube into the body cavity, it will become closed. So the answer will be closed drain. But like this, don't just mark the question, rule out the other options also. Always in the main exam, don't just jump into one answer. Look at all the answers, then only mark that. Penrose drain. So Penrose drain, I am showing the diagram. So it is an open drain. Underwater seal drain we used in chest tube. So underwater मतलब क्या होगा? Water तो रहना पड़ेगा ना. So there is no water, only like this. There should be water, but there is no water. So this is also ruled out. Penrose and underwater. Nelaton drain. This drain I also don't know. So let's rule out क्योंकि हम लोगों को तो आंसर मिल ही गया है. So this is a Romovac drain. इसके बाद वाला कोई भी फ्यूचर ईयर्स में 25-26 में दे कैन गिव जैक्सन प्रैट. So Jackson Pratt is similar kind of closed drain in like this shape. Okay. Let's move on to the next question. A patient underwent surgery for leg ulcer due to burns. What is the mechanism by which a graft receives its nutrition on post-operative day 3? So in the first 24 to 48 hours, what happens is the imbibition. We have also heard imbibition of from the moisture, the wood imbibe the water vapor and they swell up during the rainy seasons and the monsoons. Direct exchange hoga. There is no blood vessel, just it is attracting. After that, what happens? After 3 to 7 days, in 3 to 7 days, inoculation happens. Inoculation is something that pre-existing capillaries form network to supply. And after that happens is the neovascularization. 1 week to 2 week. 1 week to 2 week. That is new blood vessels form. If you don't know also imbibition, you know it is by contact. So it will be in first 24 hours or 48 hours. After that, inoculation is in the middle and neovascularization will take time. So without knowing also you can apply the common sense and mark the answer. And diffusion to hota hi nahi hai. So it is not considered. Like this, you have to keep your mind open during the exam hall. Even if you know nothing about the question, then also you can mark the correct answer by applying the common sense. A patient presented with recurrent swelling in the lower lip for past 6 months as shown in the image. What is the diagnosis and treatment? Let's see the treatment. Two are drainage, one is aspiration and one is excision. See, this is a cyst, mucus retention cyst. Plunging ranula is something different, but even if you can't make out, this is a cyst. In any case of cyst, you need to excise it. Why you need to excise it? Because cyst is anything that has a lining epithelium. With that, it has glands, and so it will secrete. If you incise and drain it, it will again form after few days, because the lining epithelium is only there. जो फ्लूइड का सोर्स है वही वहां पे है, तो तुम अगर सोर्स को ना निकाल पाओ तो फिर जस्ट ड्रेन करके क्या फायदा, तुमको सोर्स को निकालना पड़ेगा. सो यू नीड टू एक्साइज दिस होल एपिथेलियम एंड द फ्लूइड. So excision is the correct answer. You know nothing, but only one option has excision. So go with excision. This is also common sense based, because if you know that cyst is anything lined by epithelium, you can directly mark the answer. A chronic tobacco chewer presented with an ulceronodular lesion 4 into 5 centimeters in the upper lip as shown in the image. Which investigation would most likely confirm the diagnosis? So it is asking for diagnosis. If it is asking for treatment, it could be excision biopsy, but in every case we go for diagnosis, because अगर malignant ना हुआ तो topical imiquimod and many other 5-fluorouracil like these agents are there by which we can ablate the tissue. So we know that we take wedge biopsy. Now options are superficial incisional biopsy along with normal tissue could be the answer. Excisional biopsy, as I told, it is not curative, it is not asking. And the first step is incisional biopsy only. False. Brush biopsy, in these cases, it is not done. In case of pap smear, we do brush biopsy. Deep incisional biopsy of ulcer with normal tissue. This also could be the answer. Now, whether it is superficial or whether it is deep, we will go deep, because up to the whole depth we need to see that whether the basement membrane is breached or not, whether there is complete metaplasia, dysplasia, anaplasia through whole all of the layers or not. That we have to see to make the diagnosis. So it will be deep. This is also by common sense only you can solve. So let's move on to the next question. What is the ideal pressure exerted by this method of dressing for a non-healing ulcer as shown below? So this is, if you don't know, this is called a negative pressure dressing. This is a factual question, but you can remember that you need to take out the blood cells, because negative pressure, why it is helpful, because it is draining all the fluid and it is taking the WBCs to form the granulation tissue. So BP upper limit is 120. So same here, 120 mmHg. Now in the options there is no 120, there is 110 to 130. So it will be the correct answer. This was a bit of factual question, but you can remember from the BP fact, because we are also using WBCs from blood and the upper limit of the normal blood pressure is 120. Coming to the last question, identify the ulcer shown in the image below. What you can see, you have to focus on the screen. जैसे कि मेरे नीट पीजी में there was bipartite patella image and small letters it was written bipartite patella. आंसर लिखा ही था एक्सरे में, बट मैंने नोटिस नहीं किया एंड नियरली 40 to 60% स्टूडेंट्स डिडंट नोटिस. सो द फर्स्ट थिंग इज यू नीड टू फोकस ऑन योर स्क्रीन. What we can see is that there is a healed ulcer here. What is the region? This is called the gator region. Gator region में कौन सा अल्सर होता है? Venous. Supporting points. See, we can see small blood vessels. This is telangiectasia, and telangiectasia are the precursors of varicose veins, and this is called stasis dermatitis with venous ulcer. Now, why there is telangiectasia occurring? Because the ambulatory BP of the lower limb is increasing, so blood vessels are dilating. अगर और ज़्यादा dilate होगा, then varicose veins होगा in the later stage. So इन सब के लिए ट्रीटमेंट ऑफ चॉइस फॉर टेलेंजेक्टेशिया इज sclerotherapy. Now, how to differentiate between the different types of ulcers? Let's see. This is the Wikipedia image of arterial ulcer. As you can see, this is not in any specific area. Arterial ulcer usually occurs in the tips, but this is on the dorsum of the foot. So ये वाला neuropathic ulcer नहीं होगा because it occurs in pressure points. This will also not be the venous ulcer because we have seen that it occurs in the gaiter area. So this is an arterial ulcer. If you notice carefully, you will understand the punched out ulcer. What is punched out ulcer? Punched out means like this. Venous ulcer has a sloping edge. This is venous, this is arterial. In case of BCC, there is a rolled out edge. This is BCC. And this is called the classical neuropathic ulcer, hot favorite of NEET PG. This occurs in leprosy or in diabetes mellitus because there is lack of sensation. So यहाँ पे अगर कुछ trauma हो जाता है, then it develops into infection and the patient doesn't notice. The important feature is this white thing you can see. This is called the callus. Okay, why this callus is developing? Because this is a pressure site. In any area, if there is pressure, there is thickening of skin. Like if anyone is going to gym and not using gloves, here callosities will occur. So these are the pressure bearing areas and callosities develop. चमड़ा मोटा हो जाता है. जैसे कि हम लोग बोलते हैं ना कि किसी को अगर बहुत कुछ बोल देते हो एंड उसको कुछ आता जाता नहीं है, उसका गेंडा का चमड़ा है, बिकॉज ही इज यूज टू लिसनिंग वर्ड्स. बिकॉज ऑफ लिसनिंग वर्ड्स हिज स्किन इज गेटिंग थिक. सो यहाँ पे भी प्रेशर बढ़ते बढ़ते स्किन तो थिक होगा ही. सो दिस इज कॉल्ड कैलस. नाउ लेट्स सी द ऑप्शंस. Arterial I explained, why it will be not. Callus ulcer also I explained, and callus and neuropathic are the same. So these two though ruled out. So this is a venous ulcer. If you like the video and want the next part, then do subscribe to my channel. And now you can see the most important topics of NEET PG video. If you haven't watched that, go watch it now. All the best for your upcoming NEET PG.